you got a minute to talk to me a little about the incident at Grenada School last week?
In a kindergarten classroom.
She never should have been exposed to something like that at school.
A pill lying on the floor, laced with fentanyl, is ingested by a child.
When I would walk, I would start wobbling.
In this episode of Scripps News Investigates,
why did you stop investigating?
we explore the silent toll of the fentanyl crisis.
Are we doing enough to protect children?
No, I don't think we're doing enough. No.
Our months-long investigation reveals hundreds of cases nationwide of innocent children being exposed to this lethal drug.
Do you know what could have happened?
I could have went asleep and then I could have died.
And the Osprey's troubled past.
He has been coined as a once-in-a-generation pilot, which gets me so emotional.
A marvel of technology that's claimed so many lives.
If you lose both engines in a helicopter mode and you're below 6,000 feet, you're going to die.
Our investigation into what's been called the most controversial U.S. military aircraft ever built.
I'm Katie Beck in Washington. Welcome to this edition of Scripps News Investigates. The U.S. government calls fentanyl the most dangerous drug threat the United States has ever faced. For the past year, we've been investigating the silent toll it's taking on this country's most vulnerable, our children. When we discovered a kindergartner overdosed on fentanyl in her own California classroom, we started digging into this shocking case. The further national investigative correspondent Lori Jane Gliha probed, the more she learned of problems that could be leaving other children at risk.
When Danielle Mott sent her daughter off to kindergarten in 2021, she thought her child would be safe at school. Then she got a phone call that changed everything.
She's acting really dizzy and acting weird. They think she might have hit her head, so they called an ambulance.
What no one knew at the time was that 5-year-old Addison Mott had picked up a pill off the floor during her after-school program and put it in her mouth. That pill contained fentanyl.
Your child could have died.
Yeah, she could have for something that never should have happened. She never should have been exposed to something like that at school.
With her mom's permission, Addison is sharing her story for the first time, speaking exclusively with Scripps News. She says she's not sure why she decided to put the pill in her mouth.
Do you know what fentanyl is?
No.
What do you think it is?
Drugs?
Do you think a lot of kids know what fentanyl is?
No. No.
Scripps News learned of Addison's poisoning in Northern California after poring through records in more than 300 other cases across the United States of babies, toddlers, and young children who ingested fentanyl, some who also picked it up off the floor like Addison, and many who died. Her case stood out because it happened at an elementary school, while our investigation found most cases we reviewed involving small children happened at home. At the time, Danielle says no one administered the opioid reversal antidote naloxone or Narcan, including doctors, even though Addison's symptoms resembled those of an overdose. It's an oversight our investigation repeatedly found in the cases we reviewed.
She wasn't breathing, she was turning purple, her oxygen was low. At one point, she ended up throwing up, which honestly I think is one of the few things that saved her.
Do you remember how you felt?
I was dizzy. When I would walk, I would start wobbling. I wanted to go to sleep so bad.
Do you know what could have happened?
Mm-hmm.
What could have happened?
I could have went asleep and then I could have died.
She's a pretty special little girl. She means a lot. She's part of our family. It would have been really different.
Eventually, doctors transferred Addison to a second hospital, where the next day a specific test for fentanyl revealed why the child was so ill. But the mystery remained. Why was fentanyl at Addison's elementary school in the first place?
I think a lot of people might be surprised, like, how does a kindergartner get fentanyl?
Still the question, and we still just don't have answers.
So Scripps News went digging for those answers. We filed open records requests for photos, videos, school records, and police reports, including this incident report written by the sheriff's office. In it, deputies identified 3 staff members who had access to the classroom the day Addison became ill. Addison's teacher's aide, that aide's husband, who was a custodian at the school, and another instructor. We also discovered that 2 days after Addison's overdose, deputies were called to the home of Addison's teacher's aide. Records show that woman told deputies she had taken 2.5 tablets containing fentanyl and that she had been taking the pills for a few days and abusing other prescription drugs for years. Deputies conducted a search warrant at the woman's house but didn't find any fentanyl. Her husband told investigators he made sure she flushed everything.
And how old are you?
A child welfare worker interviewed Addison about what happened 4 days after she was hospitalized, but the 5-year-old offered few clues.
When you got to school that day, how were you feeling that morning? Good. Okay. Did you feel sick at all? No. Okay.
Scripps News reached out to the teacher's aide, who declined to speak with us. We learned the school terminated her about 3 weeks after the incident, but would not give a reason to Scripps News. And we discovered a deputy wrote in his incident report he believed the child's fentanyl exposure was related to the woman's drugs. But according to records provided to Scripps News by the sheriff's office, there is no indication that deputies questioned her or her husband about what happened to Addison. Deputies only documented a conversation with the other instructor who had access to the classroom that day and with a handful of staff members who worked at the school. Then, about 2 months after the incident, the case was closed pending new evidence.
It's very frustrating that nothing's been done.
We repeatedly asked the Siskiyou County Sheriff's Office over the course of several months to explain why deputies closed the investigation, but they did not answer our questions and stopped responding to our interview requests. So Scripps News traveled back to Northern California and tracked down the sheriff himself outside his public office.
About the little kindergartner girl, and I just wondered what happened with that investigation. Why did you stop investigating?
It's really hard because we can't locate the source of the fentanyl, and we couldn't locate enough probable cause to find the suspect. So we didn't quit.
We asked him why detectives did not interview the teacher's aide about what happened to Addison.
We should interview the teacher's aide. Like I said, I'm not super familiar with all the details of it, but that's what we would normally do. You know, it might appear that we didn't do a comprehensive investigation, but we did. The problem is the delay in time in locating evidence just starts to diminish. We certainly don't want to not pursue everything that we have.
After the sheriff promised to re-examine the case, he has yet to respond to Scripps News with any new details, but Danielle Mott says a deputy did reach out to her again. She is still hopeful for change.
I feel like my daughter being hurt like that, something needs to come from it.
When we come back, we explore how lawmakers are working to try and better protect young children who come into contact with this deadly drug. When Addison Mott started to show signs that she was sick in her kindergarten classroom, no one immediately recognized that she had been exposed to fentanyl. So when she first got to the hospital, she wasn't tested for it. That's something we found happen multiple times in the hundreds of fentanyl cases Scripps News has reviewed over the past year. Now, some states are requiring hospitals to screen for fentanyl every time they run a standard test for drugs. Here again is Lori Jane Gliha.
That was easy.
Lots of things like drawing come easily for Addison.
Oopsie.
But one of the hardest moments of her life so far came in 2021 when she was just 5 years old. That's when she experienced her brush with death.
Like my eyes were like drifting off trying to, and then everyone's like, no, just wake up.
How serious do you think this whole thing was?
Very serious, because if I fell asleep, I could have died.
Addison said she picked up the pill in her kindergarten classroom and ate it, not knowing it was a drug or that it contained the deadly substance fentanyl.
Do you got a minute to talk to me a little about the incident at Grenada School last week?
Scripps News obtained these audio interviews recorded by investigators. You can hear that staff members at Addison's school seemed confused by her symptoms.
Her pupils are pinpoint, her breathing is really labored and shallow.
And Scripps News could find no documentation that anyone gave her the overdose reversal drug Narcan.
We honestly thought she had a seizure or something.
Kind of looked like a concussion or something. I don't know what it was.
Addison's mother says even the doctors at the first hospital they visited seemed baffled by what was happening to the little girl.
They were worried about new onset diabetes with her, and I had mentioned, do we think she ate something or ingested something? Drugs weren't something that ever popped into my mind. The pediatrician came in and he felt like she was on something. We did a tox panel, and at that point the tox panel came back negative.
How frustrating was that?
That's what was scary. So then it went from she ingested something to, well, maybe she has a brain tumor.
Addison's initial drug panel came back negative because it tested for other substances, but not fentanyl. It wasn't until the next day at another hospital when more comprehensive drug testing confirmed what made Addison so sick. Failure to test for fentanyl is a problem our Scripps News investigation found multiple times in the hundreds of cases we reviewed involving babies, toddlers, and young kids. As a result, it affected some children's treatment, like in this case we discovered in Pennsylvania. According to child welfare records obtained by Scripps News, a 6-month-old baby entered the hospital with an altered mental state and difficulty breathing. But it was 2 days later when a specialized children's hospital finally tested him for fentanyl. Doctors gave him the opioid reversal antidote Narcan and nursed him back to health. In other cases, we found children who died. Scripps News previously reported on Louisiana's 2-year-old Mitchell Robinson, who ingested fentanyl multiple times, but continued to be placed back in the hands of the same caregiver. A March Inspector General's report obtained by Scripps News found initial toxicology screens used by the hospital did not test for synthetic opioids like fentanyl, causing confusion among child welfare workers and contributing to Mitchell's death.
Are we doing enough to protect children?
No, I don't think we're doing enough. No.
Dr. Ronit Lev is a San Diego emergency physician who served as chief medical officer for the White House Office of National Drug Control Policy under President Trump. She also helped draft California's Tyler's Law, enacted in 2023. That law requires hospitals to include fentanyl testing when they screen a patient for other drugs.
I think every hospital should do it anyway, whether there's a law or not. You put the specimen, and it goes in these little bins.
Lev showed us how the testing would work.
So, but you're saying this is something that every hospital should get?
Yes. It's like, so when people say, well, we can't do it in a rural hospital, it's like, yes, you can. I'll just teach you.
Since California enacted its law, Maryland and Pennsylvania also passed legislation. States like Michigan and North Carolina are discussing bills. And at the federal level, a bipartisan group of Congress members proposed similar bills in the House and Senate last year. California Democrat Congressman Ted Lieu is one of the House bill's authors.
So I'm pleased this has bipartisan support, so hopefully we can get it through Congress relatively quickly.
We learned Lieu's bill is significantly different from the state laws, however. Instead of requiring hospitals to include fentanyl screening in their drug tests, the federal proposal only directs the government to issue guidance to hospitals. And even that would come after a study that could last up to a year.
Medical officials across the country have already recommended that this be done in many states, so the research has already been done. Is it possible to bypass that study part of your bill and just say, let's give guidance now?
So I would absolutely consider all those options. I do know that this bill was crafted with a number of stakeholders, and we had to get bipartisan support.
It seems like it's such a long time, and this is such an urgent issue now. What do you think would make it speedier?
So we could shorten the timeline for the study. I think that is something that seems reasonable, and that's something we'll look into.
For Addison Mott, a federal proposal like that one and the California law were not on the books when she was poisoned by fentanyl. But the hospital where she was initially treated did start a new testing policy following the incident. Today, Addison is thriving, putting her near death in the rear-view mirror as she focuses now on just being a kid.
Well, I mean, since it's over, I mostly forget about it. I'm not like, oh my God, I can't believe that time happened. I'm not like that. I'm like, since it's over, it's not really that big of a deal for me.
It's been called the most controversial U.S. military aircraft ever built. The Osprey is considered by many to be a marvel of technology, but it has claimed the lives of more than 60 U.S. service members in the past 30 years. After a crash in Japan that killed 8 airmen late last year, the Osprey was grounded by the military. But this past March, it was cleared to fly again, despite lingering questions about its safety. Investigative reporter Austin Grabish with our Scripps News investigative team in San Diego has been looking into the Osprey's troubled past.
The Osprey is unlike any other aircraft in the world. It takes off like a helicopter and flies fast like a plane. Few knew how to pilot it better than Nick Lasapio.
Nick was an experienced pilot.
He has been coined as a once-in-a-generation pilot, which gets me so emotional.
Nick's fiancée, Kelsey Hancock, remembers exactly where and when he took his last flight in 2022.
I would always say, I love you, fly safe, text me when you land.
During a refueling stop on a training exercise, Kelsey received his final message.
He had texted me, hi, I love you. And I just said, I love you too.
Later that day, 5 Marines, including Nick, were killed when their Osprey crashed in the California desert. Investigators blame the accident on mechanical failure, saying a dual hard clutch engagement caused a catastrophic loss of thrust. Before the Osprey went down, Nick made a radio call warning he had a hot gearbox, meaning the aircraft's oil was too hot. Kelsey says it wasn't his first time having the problem.
He had to do an emergency landing in Syria because of an engine failure. I had heard people say things like the Osprey is a widowmaker, but I trusted in his ability.
After the accident, the Marine Corps barred most Ospreys from flying until a part called the input quill could be replaced. It's in the gearbox that houses the clutch, allowing the aircraft to fly like a helicopter-airplane hybrid. In the months following the mishap that killed Nick, 2 more Ospreys crashed, killing 11 Marines and Air Force crew members. The string of deaths led the military to temporarily ground its Osprey fleet of nearly 500 last December. It wasn't the first time this aircraft had come under intense scrutiny. We sifted through years of crash reports for the Osprey. Since 1992, we found 61 Americans have died in mishaps on the aircraft, which is made by Bell Boeing.
There are issues that are basically due to the design and cannot be mitigated very easily.
Pilot Rex Rivolo analyzed the Osprey for the Pentagon and wrote a memo in 2003 raising concerns. Rivolo wrote in his report the Osprey was prone to roll and warned its lack of auto-rotation capability did not meet the threshold for a survivable emergency landing. In a normal helicopter, if engines fail, the chopper can glide to safety. Rivolo said the Osprey couldn't do that.
If you lose both engines in a helicopter mode and you're below 5,000–6,000 feet, you're going to die.
We asked the Pentagon to respond to Rivolo's claims. A defense official told us the Osprey's drive system lets it keep flying if an engine fails, and says safety improvements are being made. They include giving pilots new cues during landings with poor visibility and mandating flight hour limits on those input quill parts that the Pentagon says are being redesigned. The military believes aging parts may be to blame for the hard clutch engagement problem that brought down Nick's Osprey, but the Pentagon admits the theory hasn't been definitively proven. Why these accidents are happening has captured the attention of the Department of Justice. Last September, it announced Boeing would pay $8.1 million to settle allegations it failed to follow manufacturing specifications when making parts for the Osprey. A Boeing spokesperson told Scripps News San Diego the company entered a settlement to resolve the allegations without admission of liability. Kelsey told us her fiancé and many others deserve accountability.
It's very important to me that we always say their names. Captain John Sachs, Lance Corporal Evan Strickland, Corporal Nathan Carlson, Corporal Seth Rasmussen, Captain Nicholas Savio.
The chairman of the House Oversight Committee in Congress has criticized the Pentagon for putting the Osprey back into the air without providing adequate information about its safety. And he said serious concerns remain about the Osprey's history of deadly crashes. I'm Katie Beck. Thank you for joining us. We'll see you next week for another edition of Scripps News Investigates.